Can you see me?
I can see you. Can you see me?
I can. Let me trying to get rid of all this junk on my screen.
I'm doing the same.
Uh,
I'm kind of curious. I feel like most members of the public probably in their daily lives don't think about epidemiology that much. And now it seems like epidemiologists are kind of the only people we can trust. How does it feel to be in such high demand all of a sudden?
this is a public health and public health practice sort of. We're hearing those words, those two words, public health, almost every day now. The language of public health is really epidemiology. So you're hearing about this in the pandemic setting, but the work of epidemiologists sort of day to day in every community in America and across the globe is something that remains often invisible until something happens. And then you sort of see a little bit more behind the scenes about what they're doing and how they're doing it and why they're doing it. And that's very much in the forefront today.
I'm curious, when you look at these statistics, the numbers of where we are now in the state of Vermont, what statistics exactly are you looking at and how do you go about reading them?
We're looking at, certainly you can look at the World Health Organization, credible source. They're doing those case counts, and you can look at those on a global scale. We're looking at the CDC, Centers for Disease Control and Prevention, and all of their daily statistics, but you're also looking at the trends over time. So if you look at this generally, you look at what's happening, how many people, and then what's that place, and then what do we know about those people, and particularly severity of the disease in the people, and then what's happening over time.
And so in terms of where we are right now, when you look at those trends, when you look at where the numbers are going, what are you seeing right now?
I'm seeing here in the state of Vermont, across our entire country, growing numbers. And they're growing at different rates. For example, the situation in New York, right next to us, is extraordinarily serious. We're also seeing high rates in Washington, and we've been hearing about that, and California, and also the South. You look at the trend, and the trend is up, all right? And so, and likewise, the state of Vermont. So what do we know? And so as I'm thinking about this, it's kind of like, what do we do? Who do we work with? What exactly do we do? And what can individuals do? And one of the things I've been talking about on a daily basis has been the science behind these social distancing recommendations. Do they really work? And is that our best protection? You hear a lot about the concerns in the healthcare setting. We're going to run out of hospital beds and critical care beds and access to healthcare. And those preparations are being made. But in public health, on the prevention side, I think the science of social distancing is really compelling. And I can tell you a little bit about why I think that works. And some of the lessons are from a different infection, but one that we have a lot of evidence about what happened, which was the pandemic flu of 1918 and 19. And there was a couple of studies that I talk about, but one was that and they did a study of that pandemic, and they looked at different mortality rates in United States cities, and they looked at about more than 20% of U.S. cities. And they found that there were differences in those actions that were taken. And the ones that did what we call social distancing, they closed the schools, they stopped public events, they isolated people who were ill from other people, they really separated people from each other. The ones that did the school closures, the isolation, and they also did the stopping the public events, had a reduction in deaths and serious outcomes from that pandemic that was different from the ones that didn't. I think that's a lesson that lasts over 100 years.
Wow. So you're saying what we're doing right now is directly related to evidence based on what happened back in 1918?
Yeah, and there's more evidence from this current COVID-19 pandemic, but we know from over 100 years ago that those strategies were very effective in reducing the most serious outcomes, the deaths from that pandemic. Now, everything's relative, so I'm not saying that the times from 100 years ago are 100% directly relevant right now, but the principle, I think, is the same. So they were able to do that social distancing over a period of, in that study, it was about 10 weeks, and that showed a dramatic difference. So, what does that mean right now? Well, we're looking at, and some of the recent papers that are coming out, and also the modeling that's coming out, is from the countries who have already experienced it or experienced past the peak of this. And so, as an example, there was an article in that MMWR from the CDC that looked at Singapore and showed that the impact of their disease surveillance. So they did more testing, and that enabled them to quickly isolate people who were sick. And they also did those same kinds of social distancing things that were done in 1918 here in the United States. And those were effective. And it's not just the government, what the government is saying, it's what individuals do. And to me, it's kind of common sense, right? If you are staying apart from other people and you might be coming down with a viral illness, well, you're not going to spread it to somebody else, right? Or if you're already sick and you're apart from other people, that reduces the number of people you spread that infection to. So these kind of social distancing principles that we're doing, like right now here in Vermont, they protect ourselves, they protect our families, they protect our friends, they protect the people we work with, and they have a huge impact on disease rates in the community.
How do you know when to put these social distancing restrictions in place? When you look at how Vermont has rolled out these different restrictions, how do you know when on that curve is kind of the sweet spot for when you can do this and really make the most impact?
My short answer to that is the sooner the better, and keep them in place as long as practically possible. So no one knows exactly how long that is. The value of doing it early is that you're in a position where you know that things are getting far worse in other areas to stop that from happening. So it gives you the potential for prevention. So as an example, what we did here in the state of Vermont, I thought was really, really good. It was strong. It was expanded. It was across the board. It was those exact same kind of social distancing strategies that we know work all the way from that 1918 pandemic.
Mm-hmm.
And we continue to repeat them. People seem to be listening. If you go out, many places are far less crowded, and we're telling people to do their best to stay at home.
One other thing I'm curious about, you've talked a lot about what it's like to kind of look at this data, look at the curves, look at the trends.
Right.
Are there things that the data doesn't show? Are there things that you study that won't show up when we're looking at the numbers of what's happening with this virus?
Let me talk about that in a general way. Sometimes when this happens, it happens really, really fast.
Mm-hmm.
And so and for example, that they had to first sequence the genome of the virus, and then you develop the test. And you're just going really, really fast while you're trying to understand who's getting sick, try to prevent that, do that public messaging, trace who exposed whom, and try and isolate them and just use the basic strategies. So I think that in this case, we don't necessarily have the luxury of having widespread data about what is this infection rate truly across the board in the community. First, it was the tests had to roll out, right? So that and then the kinds of studies that are done and can be done in terms of really looking at the specifics of household spread and community spread, it was just moving too quickly, and you have to spend your time trying to prevent it any way you can and taking care of the people who are sick. So I think that moving forward, some of these studies that are going on now will help elucidate that in hindsight, but it's not, there's never a perfect world in the time of a pandemic.
In terms of where we are right now, it does feel like we've entered a little bit of a new phase of this crisis where the restrictions have been put in place. Everyone has at least started to adjust to them. We've gotten used to social distancing. It's kind of entered everyone's vocabulary at this point. And it does feel like we have sort of reached a new chapter in where we're at. And I'm curious, what is the next shift on the horizon? Like, what is the next phase of what this crisis looks like here in Vermont and in the US?
I think it's really hard on a personal and individual, family, community level to see what's happening across the country and things getting worse, and to remain confident and rest assured that what they're doing, they need to keep doing that. And so stay in the course, everybody all in on this, and reassuring each other and supporting each other in staying physically apart from other people for a little longer than we might have thought we were going to have to do it when we started. Some of the public message is to say, keep staying distant, keep staying apart from other people, but keep connecting with people. Make sure you remember the rest of your health. And so we have to figure out different ways to, while this is happening, not to stay healthy in other ways. We can still go outside, right? When the weather gets nice, that's something that's a real positive. We're finding ways to connect with people, keeping up with school, depending on your age, and if you're at a university or in your elementary school, those kinds of things. But I think staying the course and being comfortable with that, and sort of knowing deep inside that this is absolutely going to help us.
Yeah. But you're saying we might not see some kind of major turning point in the way that this is developing for quite a while.
I can't predict that. I don't think anybody can predict that. I think we see the trends and nobody quite knows when that's going to peak. I think what we can be confident in is if everyone in their respective roles is part of being physically apart, but socially connected to people. If we're able to maintain that for the long term, we will watch. There will be serious outcomes, but we'll have spared thousands and thousands of people from those.
When do you start to get signals that this might be coming to an end? What kind of things do you look for, whether it's statistical or anecdotal or otherwise?
I'm looking at the World Health Organization, the Center for Disease Control and Prevention, and the Department of Health, of course, as the major sources. The New England Journal of Medicine puts out regular articles that are publishing results of what's happened in other countries who have already gone past the peak. I think everyone is looking at those and their experience. How fast did that happen? What did they do? And is there anything we can learn from them? And I think you watch that. There are certain countries in Europe, as an example, that are doing more poorly than others, and everybody is following kind of that sequence. Here in our country, when something peaks, what are people doing? How well are they doing it? What can we learn so that we can benefit right here in our own state, our own community?
It sounds like you're saying it's a little bit too early to even know what those signals are going to be.
We can look at the data from the CDC website and look at their maps. And I have great confidence in how they do their jobs. And we can look at similar findings here in the Department of Health. When we start to see there's a peak, and now the serious outcomes of the people testing positive are starting to go down. That's what people are looking for. The other thing is that even when we watch those curves, and we might see them start to come down, and we go, and we relax a little bit, we still may need to maintain the social distancing for a while longer. Some of the newer data that's coming out is saying we're going to have to be really careful to make sure things are really at a low level. And once we start to see a small decline, everyone wants to go outside, but just pause for a minute and wait for those recommendations. Because if we open up everything we did too quickly, is there a worry that we could see some more disease coming back? I mean, wait and see. I think we have to wait and see and follow that. We'll have plenty of information from the CDC, our own health department. We're learning more and more every day about the experience from other countries, what people are doing in our state. And I think we do have to be patient and wait to see and make sure that we can go about our lives in the same way.
Got it. Well, Jen, thanks so much for taking the time to speak with me. I really appreciate it.
You're welcome. Thank you.
All right,
Okay.
Take care.
Bye.